Hello everyone. In this video, we are going to study about the drug Lachesis with the help of doctrine of signature. Lachesis, common name Surukuku snake poison. First I'll be telling you about the doctrine of signature and then its relation with Lachesis. Then we'll go in detail about the drug Lachesis. Paracelsus was the first who advocated the doctrine of signature. So who was the founder of doctrine of signature? Paracelsus. His idea was that nature always presented the healing substance with some signs indicating their use against disease. What was his idea? Whatever the nature presented, the medicinal substances, they always had some hidden signs in them which can be used to cure the diseases. Doctrine of signature was a great source of materia medica. It became a source for constructing our materia medica with the help of doctrine of signature by relating the signs, whatever they showed in the plant. By discovering those signs, they wrote the materia medica, they proved it on human beings, they used as a medicine, and then they constructed our materia medica. Doctrine proposed that parts of the human body is having a therapeutic relationship and same plant or its parts can be used for disease of particular organ. He believed that the human body is having a sort of medicinal relationship, therapeutic relationship with the plant or the part of the plant, and the same part of the plant, like if the shape of the seeds are like kidney shaped, the bean shaped or kidney shaped, then that kidney shaped, bean shaped plant, the seed of the plant can be used to cure the kidney related problems. If the leaves were heart shaped, the heart related problems can be cured. In this way, the parts or the plant had a relationship with the human body, therapeutic relationship with the human body. This was the idea of Paracelsus, and this was the doctrine. This is what the doctrine proposed. Now we'll see what relationship does the snake have with the human body. And then how is the doctrine proposed here? The snake is restless, suspicious and revengeful. Lachesis patient is also restless, suspicious, irritable and revengeful. So here the Lachesis patient will also be suspicious. They will be like doubtful. They will never trust anybody. Like how a snake, when you pass by, the snake will feel like the person is going to kill me. So he is always suspicious. The person passing by is going to kill me, whether or not the person has the intention to kill the snake. He's very suspicious. That's the reason it bites the people. Same way here, the Lachesis patient will feel if a person offers water or something, he feels that he might have mixed the poison in the water or something like that. He is restless, suspicious, irritable, revengeful. Like you see those dramas created, those nagins and everything, ichhadaris and all, they keep the revenge and then they come and take the revenge. Same way, this Lachesis patient, if you do something wrong to the patient, he is not going to forgive you. He is going to keep that revenge he'll have the grudge in his heart and take the revenge on you later. The snake always protrudes its tongue but not steady. Similarly, Lachesis patient always opens her mouth and the tongue trembles when protruded. So they have a very trembling tongue. They do not have they protrude the tongue, it will be trembling. You see the snake, when it protrudes the tongue, it will tremble. It does not remain in a one position. Snake remains curled and silent in winter and starts moving in summer. Similarly, all patients of Lachesis, all the complaints of the Lachesis patient will disappear in winter and they will reappear in spring and likes indirect fanning from distance. So here they are saying the snake will remain curled. It means it folds and then it remains in the corner silent in a winter. But during summer it comes on. Same way, all the complaints of Lachesis patient will be disappeared in the winter. But as soon as the summer comes, the heat comes, the symptoms will aggravate. Same way, the fanning also. These Lachesis patient will require fanning at a slow speed at very distant place. They do not like high speed. Slow and a distant, indirect and distant place. The snake cannot tolerate anybody near it, which we find in hypersensitive Lachesis patient. So the snake is very sensitive. It cannot bear anybody. It cannot bear company, people around it. Same way, the Lachesis patient is hypersensitive to touch. It also cannot bear people and touch around them. Stool of the snake is black and offensive, and we also see dark and offensive discharges in the patient. So they are comparing the stool of Lachesis and the discharges of the Lachesis patient. They are dark, black and offensive. Now we'll go into the drug. Lachesis, the common name will be Surukuku snake poison. Who proposed it? Dr. Herring. Which family Lachesis belongs to? Ophidia. Introduction. Of all the remedies derived from snake poison, Lachesis predominantly leads and serves as the most valuable one. So Lachesis tops the Ophidia group. It is like the predominant remedy in the snake poisons. The curative power of this virulent venom, that is the poison of Surukuku snake of South America, was quite unknown until Dr. Constantine Herring has potentized and proved it first on himself to be of immense benefits for millions. So, Dr. Constantine Herring potentized the snake poison, the venom, and then he proved it on himself, and then it is of use for millions of people. The idea, greater the poison, greater the remedy, eventually struck him, resulting in his greatest contribution to the generation of patients suffering from many desperate diseases, especially at, during, and after climacteric age. For those who have been changed both mentally and physically and are thin and emaciated rather than fleshy. So, the Lachesis patient will be thin and emaciated. All the complaints will arise from the climacteric age. Clinical: alcoholism, apoplexy, asthma, boils, carbuncles, change of life, cough, diphtheria, epilepsy, enteric fever, flatulence, gangrene, hemorrhage, hemorrhoids, heart affection, headache, jaundice, laryngitis, liver affection, mental disorders, malignant pustules, neuralgia, pneumonia, puerperal fever and convulsions, purpura, pyemia, quinsy, skin affections, throat and lung affections, ulcers, varicose veins, vertigo, etc. In all these cases, Lachesis can be prescribed. It is used to treat all these diseases. Sphere of action: being a constitutional, deep and long-acting polycrest remedy, Lachesis has a great affinity for almost any and every organ in the body. However, its action are more manifest on the nervous system, mind, cardiovascular system, skin and mucous membrane, respiratory organs, heart, kidney, female genital organs. So you need to know the sphere of action. First, Lachesis is a deep acting polycrest remedy. It will act upon which all systems? Cardiovascular system, respiratory system, kidney, female genital organs, mind, first thing mind, nervous system, skin, mucous membrane. Pathogenesis: like any other poison, Lachesis disorganizes and decomposes the blood, making it more fluid and non-coagulable. So, the Lachesis is going to decompose the blood and then it will make it non-coagulable. The blood cannot clot easily because it becomes watery, thin, decomposed, resulting in hemorrhage, asthenic and malignant inflammation, ecchymosis, gangrene, abscess, pyemia, general typhoid condition and jaundice. It irritates the peripheral nerve, setting in hypersensitiveness. Why is the Lachesis patient hypersensitive? Because there is an irritation caused to the peripheral nerve. While its action on the pneumogastric nerve causes irritation of throat, larynx, bronchus and heart, it poisons the nerve centers, producing profound prostration, convulsion and unconsciousness, implicating the functional integrity of the brain. So, how does the Lachesis act on the nerves? First, it will act on the peripheral nerve. It will bring in hypersensitiveness. It will act on the pneumogastric nerve and it will cause the irritation of the throat, larynx, bronchus and heart. Then it will act on the nerve centers and it will produce convulsions, unconsciousness and it will hamper the integrity, the structure of the brain. Constitution. Now let us see the physical makeup of the body, how the Lachesis patient looks like. It is ideally suited to thin and emaciated subjects during and after climacteric age. Here climacteric is the menopausal age. During that age the person is thin and emaciated rather than being fleshy, who have changed both mentally and physically by their illness. The person will be suffering with some illness which is going to change him both mentally and physically. To persons having disposition to low spirit and indolence with blue and purple look. So here the patient is low spirited. They will have a blue and a purple look. Temperament melancholic and sad. People will be really sad here. Patients are easily affected by heat in general, under all circumstances and in all cases. So here they are saying the thermals. Lachesis patient cannot bear heat. Here the patient cannot bear heat. All complaints are going to aggravate in summer. So the patient is affected by heat. Hot patient. Miasm. In Lachesis we find one of the greatest antisoric remedy. Sora is in the background of all the troubles. In the miasm, Sora will be in the background. Diatheses, hemorrhagic diatheses. They bleed very easily. The smallest injury, they bleed very easily. Hemorrhagic diatheses, bleeding tendency. Now let us see the guiding symptoms for Lachesis. Lachesis predominantly a left-sided remedy. All the complaints will commence in the left side and go to the right except the lower limbs. So Lachesis is a left-sided remedy. They start from the left, the complaints go to the right, but this does not happen in the lower limbs. All the symptoms are worse during and after sleep. Lachesis sleeps in aggravation and aggravation from sleep. Because of the increased sufferings such as suffocation, pain, etc., the patient is terribly afraid to go to sleep in spite of the fact that sleep is really needed. Here, in Lachesis patient, all the symptoms are aggravating when he goes to bed and after he sleeps. So because of the suffocation, because of the pain, the patient is really afraid to go to bed. So even though he is sleep deprived, he doesn't want to sleep. Great sensitiveness to touch all over, especially throat, abdomen, etc. Patient cannot bear clothes to touch, which causes uneasiness and produce nervousness. There is a great intolerance of tight clothing, wants everything loose. Same thing in Apis mellifica. So here the saying is the patient cannot bear any type of tight clothings. You see, they'll wear all loose clothings. The Lachesis patient cannot bear even the touch of the cloth. He's so sensitive. It produces nervousness in the patient. Most of the complaints are relieved by menstrual flow. Like how we read here in the doctrine of signature, the discharges, they will relieve the symptoms. Here the complaints are relieved by menstrual flow in Lachesis patient. Climacteric ailments have never been well since that time, says Lachesis patient, referring to menopausal period. Like how in Pulsatilla, patient says that since puberty the patient is not well, all the complaints started from the pubertal age. Same way in Lachesis, the patient says that all the complaints commence from the menopausal period. He has never been well since the menopausal period. Burning all over the body, hot flushes and hot perspiration, hot hemorrhages, burning on the vertex, etc. So you see, it is referring to the menopausal period. So the symptoms of menopause, hot flushes and hot perspiration will be felt in the patient, and there will be hot hemorrhages and burning on the vertex. On the top of the head, the vertex, there will be burning. Blueness and purple color in every trouble amply singles out Lachesis. You see, it is a characteristic feature. There will be purple and blue color. They will have the face which is the blue, purple in color, and the skin and the ulcers are blue in color. Blue and purple face. face will be bluish and purplish, and the skin, the ulcers will be blue in color. The inflamed spot is purple. The inflamed spots which they are having, they will be purple in color. A sense of constriction and tight feeling everywhere, heart, throat, etc. Sensation of a ball in the inside of organs, especially urinary bladder. You see, inside the organs they feel as if a ball is present, especially the ball sensation is found in the urinary bladder. Great desire for fanning. So as they are hot patients, they require fanning, but slowly and from a distance. Medorinum, rapidly and from near. Carbovec, same. Great physical and mental exhaustion, trembling in the whole body. So these people, they will have a great physical and mental exhaustion, which will bring in their body starts shaking, trembling in the whole body. Trembling tongue, difficult to protrude, trembles like that of a snake, tongue is black. So they have a trembling tongue, as we read in the doctrine of signature thing. Desire for wine, liquor and coffee, aversion to food, acid and drinks. The desire for wine, liquor, coffee, aversion to food, acid, drink. Food, acids, drink. Hemorrhagic diathesis. Small wounds will bleed easily and profusely. Croton or creosote, hamamelis, china, sickle core, phosphorus, all these remedies. Also, the small wounds will bleed easily and profusely. Just the finger cut and the bleeding will be profuse. Bleeding with malignant and asthenic inflammation, gangrene and pyemic conditions. Character of the blood is dark, watery, offensive, non-coagulable. As we read in the pathogenesis, that the blood will be disorganized and decomposed. Same way, it will be non-coagulable here. Mind. The mind symptoms are really interesting. Lachesis patient develops very striking mental symptoms, which are as follows. Great loquacity, which means very talkative person, wants to talk all the time, but without any relevancy or consistency. Even though a person is speaking, something should be relevant, or he should have some consistency in his speech, but Lachesis patient speaks irrelevant things. No head or tail, jumps from one idea to another. Every word is leading to a story. You just ask them, hi, hello, how are you? They start saying, you know what happened, and then everything they start a long story. The patient thinks that he or she is under the control of some superhuman being and has power to bless or cure or curse. So the person feels that he's under the control of some superhuman being. He can bless people, he can cure people, he places himself in a higher position, even has command over others, which means the Lachesis patient is very dominant. In a group of friends, this person will be dominant. He feels like whatever he says, the other people has to obey him, and actually expects that others should obey him or her. Feels she is empowered from heaven above and to steal or to commit murders. She is possessed of some religious mania and insanity. So she is religiously madness. She'll have madness and she'll be insane. You feel that the person is possessed. She is very jealous and suspicious. The aspects run through the whole of the mental plane, suspects everything around her and has no confidence in others. So the Lachesis girl, she'll never trust her husband. She will always be suspicious. He might be cheating her. She never has confidence in the person. Same way, the same way will be with her siblings, her friends and everything. Lachesis patient is jealous and suspicious. Dreams of snakes, of her own death and funeral, sometimes overjoyed and sometimes melancholic and sad, unhappy, depressed, aggravated in the morning on waking. So whenever the patient wakes up in the morning, all the symptoms are going to aggravate. Once at some time she'll be overjoyed, and then she becomes all sad and gloomy. Memory is weak and they may have the inability to think. Feels she is full of wickedness and has committed some serious and unpardonable sins and crimes, that she is going to die and will go to hell. So she feels that she is wicked and she has committed so many unpardonable sins. Nobody is going to forgive her sins, and she is going to end up in the hell. All the mental symptoms are worse after sleep. Ailments from long lasting grief, sorrow, fright, jealous, vexation, disappointed love. Same ailments from are in the aurum metallicum, ignitia, phosphorus. Bad effects of poison, wounds, post mortem, suppression of quinine. With this, we come to the end of the guiding symptoms. Hope everything is clear. If you have any doubts, you can ask in the comment section. And if you like my video, hit the like button, subscribe to my channel. In the next lecture, we'll be dealing about the particulars of Lachesis. Thank you.